Cross Blue Shield standard plane. And this gets into the last thing, and I talk for her, and Susan, I will sit down. And that is, you heard a lot about, in the last month or two, about policies being canceled. People saying, well, I can't keep my policy. For the most part, and I'm only speaking for myself now, in my own opinion, for the most part, a lot of those policies were what I call skeletal, or catastrophic policies. In other words, and this is an extreme example, but I use it because one of my Republican colleagues criticized me at the Rules Committee one day and said, well, you don't believe in freedom, Congressman Pallone. And I said, well, freedom, and this is in the context of health insurance. And I said, well, what do you mean freedom? And they said, well, I have a constituent who pays $60 a month for health insurance, and they should have the freedom to be able to continue to have that policy. This was the issue a few months ago when the President issued his executive order saying that you can continue your policy if the insurance company wanted to sell it to you, even if it was a skeletal or a bad policy. And that's what he did. Not every insurance company is offering it, though. And I said, okay, for $60 a month, what do I get? And what I found out is that it didn't include hospitalization. Okay? So I said, well, why would I want an insurance policy that doesn't have hospitalization? Because in my mind, the main reason I buy an health insurance policy is so I have hospitalization. And I won't tell you what it did include because it's even more absurd. But it did include hospitalization. So the Congressman, who was a Republican in Florida, said, well, my constituents should have the freedom to have an insurance policy that doesn't include hospitalization. And I said, well, that's very nice. I said, but, first of all, does she know that it doesn't include hospitalization? All right. And secondly, what about when she goes to the hospital and everybody else pays for it but she doesn't pay the bill? All right? And that's the problem. You can criticize the Affordable Care Act by saying that people should be able to do what they want, but it has implications for everyone else. And frankly, if you're going to buy an insurance policy that doesn't include hospitalization, I don't know why you even want it, to be perfectly honest. And it's not fair to all of us, because we know that if you went back to before the Affordable Care Act in the state of New Jersey, over $1,000, maybe more like $1,500 of your premium that you pay if you have coverage is paying for the uncompensated care of the people that don't. And I don't think that's fair. And that's not freedom. My idea of freedom has to do with democracy and civil rights, not freedom to have a bad policy. All right? So I think I'll leave it at that.